Hello, everyone. Welcome to the sixth installment of Equity in Action. I am Tom Strong. I am the Director of Employer Activation here at the National Fund for Workforce Solutions. This series is part of CareerSTAT, which is our national healthcare sector strategy. It's a key part of our work to activate employers and make jobs better. CareerSTAT, in turn, supports our peer-led Frontline Healthcare Worker Champion recognition program. We relaunched this program last year, and we are thrilled this year to recognize 8 organizations that have been creating great jobs, building more equitable workplaces, and making significant investment in the skills and the careers of their frontline workers. Equity in Action is our way of inviting you into conversation with these institutions. You're going to get a taste in this conversation about what programs and the practices that champions like today's organization have in place. And there's going to be future opportunities for CareerSTAT members to take a deeper dive with these folks. Please write down your questions. We will have a Q&A period at the end of our conversation today. And today's conversation is going to focus on Trinity Health, which is a national health care organization across the country, but with a particular focus on their work in Michigan. And today, representing Trinity Health, we have our guest, Shana Lewis, who is the National Executive Lead of Workforce Development for Trinity. Shana, welcome and congratulations on this recognition.
Thank you. Thank you. It's a pleasure to talk to you today.
Likewise. So Shana, let's start a bit on the personal side. We're all about workforce development and career journeys here, so we'd love to know a little bit about yours. Tell us about your own career and how you came to work at Trinity.
Yeah, thank you. And it certainly has been a journey. I think I am one of the testaments of career advancement and career opportunities and access to career advancement at Trinity Health. I have been with Trinity Health for 10 and a half years. I started in 2013, and I led a lot of regional work at that time. So I was overseeing talent acquisition, primarily in different sourcing strategies for a 5-state footprint. And I also got started at a time when there were more people than there were jobs. And that quickly shifted at over 1 year. But in the last almost 12 months, my focus has shifted, and I've had the opportunity to lead solely workforce development as the executive lead for Trinity Health across our 27-state footprint.
Mm-hmm.
So that's been a real pleasure and a real joy to be on this particular journey to expand and advance a lot of the work that we did in Michigan that we'll be talking about today.
So Trinity itself has this rich history, and as you mentioned, you're in 27 states across the country, and it's always, in our experience, deeply embedded in the communities it serves. Can you tell us a little bit about the organizational history and how it came to have its community orientation?
Yeah, we're a Catholic-based organization, so our roots and our mission is community and serving those in our community. You're correct. Trinity Health has a very rich history in investing in community. In fact, we make very substantial community health and well-being investments. In 2023, we actually made over a $1.5 billion investment back into our communities. Beyond that, we also have been investing in different partnerships and councils. We actually were one of the founding anchor organizations for HAN, the healthcare network. And so we have a rich history of investing in our communities. So workforce development, albeit we've only been on this journey for about 10 years, really supports the mission that we've been on for many years.
So to dive in deeper, like you previously worked in the Trinity Health regional space in Michigan, especially, and let's focus on Michigan. In Michigan, Trinity has a regional partnership, I know, of multiple hospitals, and I think over 28,000 employees. Tell us a little bit about how Trinity's community outlook, as well as its business needs in Michigan, led to its current orientation around workforce development, and especially the building talent bridges approach that you helped develop.
Yeah. So, as I had mentioned in our opening time together, I started at a time when we had more individuals to hire than we actually had jobs to fill. And that quickly shifted. But I was actually hired to lead change, and that was change in our talent acquisition practices, and that was also change in how are we coming alongside of our colleagues and helping them advance and grow their careers with us. And at the time, that goal and aspiration was really mission driven.
Hmm.
We wanted to ensure that we were being good stewards of individuals that were entrusting their careers to us. Fast forward a year after 2013, and we started to look at hiring demand projections in 2014 and 15. We started to realize that our mission focus also needed to shift into a business strategy on how we were going to create workforce and create the workforce that was needed. That was 5 years before the 2020 pandemic hit.
Right.
So we knew then that it was critical for us to really start building community relationships. And so relationships are important. We knew that as we were looking at the workforce projections in West Michigan as a whole, not just for Trinity, that we were going to have a real shortage in supply in some of our critical roles. And so I had the pleasure of working with our Trinity Health team, and we created the first inaugural Building Talent Bridges event, where we brought together 100 of our community partners. We had training partners in the room. We had deans and presidents of colleges and community colleges and universities. We had our own executives there that were invested in this conversation as well. And we wanted to provide information about Trinity in a very transparent way. And that information was around, our workforce forecasting. It was around our diversity and where colleagues of diverse ethnic backgrounds, et cetera, sat in our organization. We even shared turnover data. And so that really started to bring together the community and the workforce development ecosystem that we created in Michigan.
I love what you said about change there, because we often, like in workforce development, we don't always talk about it as change, but it really can be, especially in a circumstance like your organization faced in terms of the changing demographics and the changing challenges of how healthcare is delivered. You later played a lead role in creating a program called Rise Up that I think addresses this kind of change in a really meaningful way. So very much focused on helping frontline workers with career navigation. Why did your team see that service as necessary, both for the organization and for your employees?
Yeah. Well, we knew that we needed to do something. And Rise Up is really a program name for the work that is performed in our career services center. And that career, I just want to make a very good point here. That Career Development Services Center and the Rise Up program was designed in the CareerSTAT Employer Academy after we were awarded the Emerging Champions Award in Philadelphia. And so we had a chance to take a year through that academy and really decide what type of meaningful work that we were going to embark on that not only aligned with our mission, but also aligned with a business need for us. And so Rise Up was designed and created. Special thank you to CareerSTAT for allowing that space for us to create that program, but also to Tracy Kaufman of the W.K. Kellogg Foundation, who came alongside of us and provided the funding that was needed over 3 years, with the thought that we wanted to impact 400 plus individuals over 4 years. And that's really when we started the outside in, inside up model that we have today. So really looking at, how do we serve the individuals in our community by giving them access to meaningful job opportunities, giving them access to support services by partnering with our community partners, and giving them access to tools and resources that would help them determine which career path they needed to take and what job they would be the best fit for. So if that answers your question, sorry, I get a little long-winded there.
No, that's great. And hearing you talk about that, like one thing I can tell is that you designed your program according to what we at the National Fund have identified as the most important drivers of career navigation success. So career navigation is driven by a few different things, but what we have found, this was in a report we did last year with the Harvard Institute on Workforce, is access to accurate information about your career options. That's one key, and clearly that was reflected in Rise Up. Another key is access to skill development and credential attainment. Another key is access to social networks that can help you think about your career options. And then the wraparound supports, I think, is another piece that's really important there.
Mm-hmm. Yeah, and Rise Up had all of those elements in it and all of those components. And in fact, pre-virtual space that we've shifted to, we actually, our Career Development Center actually it was a one-stop place for individuals in our community as well as our own colleagues. And they could come there and not only meet with somebody from Trinity Health about what opportunities existed and what skills and education and credentials they might need to get into their next career. But we also made space for our community partners to have offices at our campuses. And so our workforce development partners, West Michigan Works at the time, had a career coach that was there that helped individuals navigate resources as it relates to their education and upskilling. So funding, program opportunities, et cetera. And then we also had a support services that was also housed in that one-stop center. And that was the Source. And they had a resource navigator that was there as well. And so sometimes your employees don't feel real comfortable coming to you, sharing that they have housing issues or transportation issues, but they felt comfortable going to somebody that was a third party. And so we had all three. We had Trinity Health, we had our workforce agency partners, and we had our support services all in one location for our colleagues to access.
Just as a point of clarification, so the Source I've heard of before, that is an employee resource program. I think it's headquartered in Michigan.
It is. And they provide those support services that we didn't realize were so deeply needed for a lot of our frontline colleagues in regards to transportation and housing and daycare and even driver's license reinstatement. They came alongside of individuals and really helped them remove those barriers.
That's really fantastic. It's kind of a turnkey operation that you've developed. I'm very impressed with the idea of having a one-stop, like right in your facility for people to access and address all these different barriers to work.
Thank you. It's been rewarding. Some of the outcomes from that has just been greater than what our expectations were. Really, we received, the funding and the opportunity to impact 400 individuals, and we exceeded that number. Different participants that came through the program, and that we were able to help career coach, help get resources for. But 117 individuals had the heaviest wage impacts on wage increases. Just over $1.4 million that helped 117 individuals increase their wages. So pretty significant, life-changing when you can receive that type of support that advances your career.
Yeah, so in the aggregate, $1.4 million more.
Yeah.
That's like $12,000 per person per year.
Exactly. And so we're talking about equity in action, right?
Yeah.
And that's our best example of it.
Yeah. I just want to go back to one other thing you said, to make sure I understand it. So you talked about your, I think, outside in, inside up approach. Can you say a little bit more about what that means?
Yeah. So the 400 individuals that we were focused on, 300 of them we wanted to pull from the community. in the community that we served. And most health ministries, or a lot of health ministries, I should say, are sitting in communities that have the greatest need for equity, for help, for access. And so looking at the zip codes around the ministry that we were in at that time in West Michigan, we wanted to provide access to greater opportunity and greater equity for 300 individuals in the community. And then we wanted to take over 150 individuals internally and provide them clear career pathways and career navigation to increase their skills and advance in their career that would increase their wages. And so that outside in, inside up model was quickly adopted and accepted by Trinity. And it still is today.
That makes a lot of sense. And I love the community engagement piece. It clearly ties to Trinity's origins as well. So we're getting to the point for the audience to ask questions. I want to open up the door to that. I see we already have some comments coming in. One person mentioned that they love that the center offers resources for staff and community members, and that co-location makes for a much better user experience. And yeah, that definitely seems to be true and very validated from Trinity's experience as well. If you've got other questions, please chime in now. You can just enter your questions directly into the LinkedIn chat and we'll see them. I'll read them out and Shana can respond.
Well, I know we don't have any questions right now, but I will say that I am looking forward to seeing everyone at the convening of Shift. And so hope many of you are there and I get a chance to connect with other individuals and learn from other individuals as well. But the Shift convening will be a really special time for us, especially given the recent recognition from CareerSTAT.
Yeah, we are very excited about Shift as well, and I'll have something to share about that in a moment. We do have a question that came in. What are the key roles that you focused on training community members to take on?
Yeah, so we have, knowing that many of the community members were going to come in with no experience or very little experience. Some of them had more industrial types of skills. And so our first initial thought was, what's the path of least resistance and how quickly can we get them into the healthcare environment? So many of those roles were more in our entry-level roles. So pharmacy technicians, nursing assistants, phlebotomists, environmental services. And so those were the roles that we focused on bringing our community members into. Now, if we identified community members that had transitional skills from other industries, then certainly we plugged them into talent acquisition right away to see if we could get them an opportunity in the more higher paying wage roles.
That's great, thank you. One other thing I'll flag while we wait for any other questions to come in is that when our review committee was assessing this year's candidates, one strength of Trinity that really jumped out was your focus on equity and disaggregated data among the populations that you were serving. And that was something that came through very clearly in your application and kind of really shows up in your outside in, inside up approach as well.
Thank you.
We have another question here, which is, did you offer training in-house or do you partner with community colleges and other training organizations?
We try to well, let me answer that directly. Primarily outside training. And that's very intentional. Not that we don't have wonderful development opportunities in-house, but it was important for us that we partnered with our community colleges, our workforce agencies, our training partners in the community. Because one of the things that was really important to us at the time, and still is that we help people advance in their lives and in their careers. And we hope that they'll do that with Trinity, but we also want to equip them with industry recognized credentials so that in the event that they have a life event that they have to relocate or go to another organization, that training and those credentials and those skills aren't specific to Trinity Health.
I think that's a really key piece of any successful workforce development approach, that it be transferable as well. Another question has come in, which is that it sounds like leadership was on board to make changes from the start. Do you have any tips for making the case to invest in frontline workers to leadership and or to mid-level managers?
Yeah, so at the time, when we started on this journey around really developing and providing greater access to our own colleagues, I had mentioned that it was a very mission-driven thing. We wanted to make sure that we were being good stewards of our talent and our resources that was coming to work for us every day. When we started to look at the data in 2014, 15, and then beyond 2020, it became a business need. And I think that business need exists in every organization, not inclusive to healthcare. So when we looked at what are our priority roles in healthcare that we need to solve for, that we have shortages in, shortages because there isn't enough talent in the communities that we serve. And then we looked at the assets that we have, and our assets were sitting in a lot of those frontline workers. And it was like they want opportunities to grow and advance. And at the same time, we need them to grow and advance into more of those clinical, patient-facing types of roles. And so going to the executive leadership and presenting to them that we have, just under 30,000 entry-level colleagues or colleagues that are sitting in more entry-level roles. And we've got, a high demand in some of these other higher paying wage roles. I didn't really need to say more. The executives were on board with, what do we need to do the right thing for our colleagues and to help close the workforce gaps that we know we have. So I would say use your data to your advantage, but also make sure that it does have some mission alignment as well.
Mm-hmm. And that is definitely a theme that we heard when we had in our previous call, Bay State Health here. They also talked about the power of having like a compelling data set that they can use to really make the case for this kind of investment. Mm-hmm. And like Trinity, Bay State also, I can say, was really sparked by their participation in the CareerSTAT Learning Academy as a way to start thinking about their data challenges. We've got a couple more minutes for questions. Does anyone else have one? While people think, I'm going to share a couple more details about SHIFT. Thank you for prompting that, Shana. SHIFT is our national convening at the National Fund that we are holding this year in Memphis, Tennessee. It's going to be September 24th to 26th at the historic Peabody Hotel. We will share the link in the chat, but we are still, the registration is still open. We are adding new people every day. We're really excited about the speakers and events that we have coming up for SHIFT. And we are filling out the details of the schedule every day on our website. One thing for folks on this group to be aware of in particular is that we will have an employer affinity event on the pre-day of SHIFT on the 24th from 12 to 4 p.m. That will include folks from both healthcare and manufacturing and construction, all kind of learning together about best practices for addressing those career navigation drivers and creating career opportunities for frontline workers before breaking out into separate industry groups. It is principally focused on employers. So we are looking for employers to come to this event. But if you're a workforce intermediary, you can also reach out to an employer partner to join you and come together. But it is free if you are already signed up for SHIFT. We want everyone to be aware of this opportunity. We do have one more question that's come in. This will be the last one today, which is, do you connect with students or faculty at your community college partners?
Both. The students, we have recently started a really strong student engagement strategy, because those are individuals that are already in programs that we can provide opportunities and access to careers in their field. But the faculty also helped us design some of the programs that we have. So when we think about our apprenticeship programs and our work-based learning programs, we really leveraged the faculty as well as our own frontline leaders to help develop some of those programs.
Thank you, everyone, for your questions. This has been a fantastic conversation. I want to say first, it does not have to be the end of the conversation. We've got a few ways of keeping this going. So one is that we have a platform that we use called Mobilize. If you're in CareerSTAT, you have definitely received an invitation to join Mobilize. And if you haven't, we're happy to share one with you today. Anyone in CareerSTAT can use Mobilize. It's kind of like a social media platform. And you can join to connect with your peers and to learn more about these topics, including from folks like Shana, at any time. Claudio has just shared a link to Mobilize in the chat. I see we have one more question, so I'm trying to make a little bit more time for that one, Shana. And then I know you have a hard stop, so let's get to this last question, which is, are you working with other industry employers or Trinity locations to replicate Rise Up and or lessons learned from it?
Yeah, absolutely, both. So I mentioned that I spent about 9 years or so leading talent acquisition and workforce development and sourcing and some other talent strategies, primarily in a region of 5 states, and heavy focus in Michigan because that's where the work originated, and we had some amazing executives that supported the work. But then I was asked to lead this workforce development work and talent strategies, talent innovation across our 27 state footprint. And so Rise Up programs will be rising up in all of our communities, hopefully. With regards to other industry leaders, absolutely. I can share that our apprenticeship program, which was one of the first of its kind 10 years ago, we created the medical assistant apprenticeship program. It was one of the first of its kind in the healthcare industry as a whole. We took a play out of manufacturing and construction for that. And we didn't guess at it. We actually worked very closely with those sector partners on understanding how they created their apprenticeship programs and what made it successful and what were some lessons learned. And we still do that today. We cross over to other industries to learn and grow from what they're doing. We recently had a conversation with John Deere on a program that they have. And so we are not strictly healthcare exclusive. We want to broaden our knowledge and understanding and learn from other industries and other sectors.
Shana, I know we're at time. This has been fantastic. Thank you so much for your time today and for being such a great member of the CareerSTAT community. Mark your calendar, everyone who's still here, for the next event in our series. The next interview is going to be Wednesday, August 14th at 1:30 p.m. Eastern with Ascension St. Vincent Health. And again, remember about Shift, remember about Mobilize as a way to keep this conversation going. And again, Shana, thank you so much. This has been great.
My pleasure. Thank you so much, Tom, and CareerSTAT.